Session titled Addressing Barriers and Challenges in Patient Care. Thank you for joining us. My name is Lee Clark, Director of Patient Services, and I'll be moderating the presentation today. As we get started, I'd like to recognize the generous support of our corporate sponsors and the generous support of patients, families, and caregivers for supporting the conference today. During the presentation, we will be taking questions and comments from the audience, from the online participants. So please be sure that you're typing in your questions and your comments in the text box using the Q&A icon in the engagement panel on your right. We'll do our best to make sure that we include everyone's comments and questions during this interactive panel. I do ask when you post your comments or questions that you do two things to help me manage the incoming questions. Submit all your question at the same time, and please do not share private health information in your question. Our panelists will not be able to answer any specific questions related to your personal health care. Our specialist today is Kimberly Miller. Kim is a blood and marrow transplant case manager at Nebraska Medicine and a member of the leukemia team. She earned a Bachelor's of Science in Nursing and is a bone and marrow transplant certified nurse. Thank you so much, Kim, for joining us today. It's a pleasure to have you.
Thank you for having me. It's wonderful to be here. Today, we're going to have a panel discussion with a couple of our local patients here who have undergone some treatment and things, one for aplastic anemia PNH and one for MDS. We'd like to get their perspective about overcoming barriers and challenges to their healthcare and just learn a little bit about their healthcare experience. This is meant to be an interactive discussion, so we'll be doing a lot of back and forth, and we would really welcome any questions or comments from the audience or any online participants so that we can just kind of have a really nice discussion about that. So I would like to introduce Roger and Barb, and Roger is going to speak to us from the perspective of aplastic anemia and PNH. Barb is going to speak to us from the perspective of somebody with MDS. So I'm going to have Barb speak first, and I just want you to chat with us a little bit about your diagnosis and how it was discovered and a little bit about your journey up until this point today.
Thank you, and thank you for everybody that is participating virtually. My name is Barb. I was diagnosed a little over 6 years ago with MDS. My process started with me fainting at home, and my neighbor just happened to be over and scared her and scared myself, so I thought maybe I should go in and see my PCP. So that's what I did. He drew some labs. He didn't like what he saw, referred me to a hematologist. Went to that hematologist. He drew labs as well and saw the same issues and decided to do a bone marrow biopsy that day. I knew at that point that something was more serious than just I'm anemic. My mom actually had multiple myeloma, so of course my mind went to there first. Anyway, it was probably a month later that I got the results of that biopsy. He had referred or got a second opinion from Dr. Gundabaloo at Nebraska Medicine, and they confirmed that it was MDS. And I was like, I've never heard of that. What does that mean? He explained to me that it was considered a blood cancer, and this is what was happening. And he said, our usual approach is watch and wait based on your counts, based on your biopsy results. And I was like, watch and wait for what? And I had to watch and wait for my numbers to change or the disease to progress. So for the first 5 years, I was in watch and wait. Did regular labs, looked at those counts, had another bone marrow biopsy, looked at those results, and have stayed in that until I hurt my leg, slipped and I hit my leg really hard, my lower leg, and he considered that a significant bleed in the fall of 21. So he asked me if I'd like to try an immunosuppressive therapy treatment. And I said, sure, let's try it. So that was a 5-day in-hospital stay. It's called anti-thymocyte globulin with cyclosporin. Short for that is just ATG. That particular treatment did not improve my numbers, but it didn't decrease it or make it worse either. So currently, I feel like I'm back in watch and wait. My numbers have remained stable, and I feel very fortunate for that. I just met with him this week, so that's what we went over after my most recent biopsy. And we will continue to monitor my particular situation I have weekly labs, so he can keep an eye on it that way. And we are looking at doing another biopsy the end of this year and look at those numbers as well. With MDS, he wants to keep track of any molecular or genetic changes in my bone marrow biopsy. That's really how we decide what are the next steps in a treatment plan. So I'm thankful for stable numbers, and for now I'm going to just stay there. So.
Hello, I am Roger, and I will turn 75 in 3 weeks. When I was 22 years old, I was diagnosed with aplastic anemia. I was a two-sport guy at the University of Minnesota, and I noted the last year of fatigue, not being able to keep up like I used to because I was always in tip-top shape. And one of my friend's wife was a nurse, said, "You're very yellow, you might have hepatitis, go on in and check it out." So I went in, they took blood, and they eventually took bone marrow samples too. And they said, "You have aplastic anemia." Well, I had never heard of it, and there weren't that many cases, so a lot of people hadn't heard of it. And my red count was 3.9, my platelets were 8,000, and my whites were under 1,000. That would be considered a very severe case. And since there were no bone marrow transplants at the time, and there were no other types of treatment available, I said, "Well, give me the real facts here." And they said, "If you make it 5 or 6 months, that's probably pretty good." And I'm thinking to myself, I'm 22 years old. I don't like the 5 or 6 month program. So I remember being in the hospital, and I dreamed that I fell into like a black hole, and I kept falling and falling and falling and falling. And when I woke up, I kind of came to the conclusion, I'm not going to die. I will not succumb. And being stubborn and being a rule breaker my whole life and being an athlete and overcome, I thought, I'm gonna beat this thing somehow. So we had clinic every week, and again, this is pre-bone marrow transplant days. They were in the in the early 70s. They were in the very early stages of it, so it wasn't really an option. They tried decadrabalin and oxymethylone, which were steroids, gave me breast tissue, the usual things of getting fatigued walking upstairs, macular hemorrhaging, bruising, low platelets, bleeding gums, I mean, you name it. And a very, very bad case of pneumonia, which I survived, and a lot of people back then did not. And I started doing transfusions, 4 packed red cells, 4 bags every 6 weeks for 11 years. So that's 70-some transfusions. The mental thing was, again, I've never been a quitter, but I've always been a fighter. And I think that if you've been diagnosed or you've got family that's being diagnosed or whatever, the will to live and the will to try anything is important. Since there was no medical stuff at the time, or traditional Western medical, I did transcendental meditation, ballet, deep breathing, faith healers. I went to faith healers. I did imaging, exercise therapy. I would push myself to the point where I was panting to get rid of the lactic acid. I go back out on the basketball floor because I was a basketball player. I'd play for 2 minutes. I'd be completely blown, take myself out, go back in, go back out. But I think pushing myself was very important, and having an attitude of I will not quit. And believing in God. I think those are all very important things. And I don't think it's any different today than it was in the 70s and 80s. You get something like Barb is fairly recent, I would consider recent, in a diagnosis. But you have to look at the long plan and say, every day I'm living what I've got. I've got what I got, and I'm going to make the most of it, and I'm grateful. Tomorrow I wake up, I'm grateful I'm still here. And I think attitude is really, really important.
Thank you both for sharing some of your stories. I think I just wanted to kind of dig a little deeper and really kind of talk about your journey a little bit. What I picked up from both of you is you were okay until you weren't okay. And it was a very unexpected, life-changing diagnosis, I think, for the both of you. You both had some paths that you were taking, and obviously MDS and aplastic anemia were not part of that plan. So I just want to talk a little bit about some of the resources that you had available to you at that time, or what kind of some of the initial obstacles were that you faced when you were first diagnosed. Knowing that, and in the audience too, we are a very large country and we have a very large rural population as well. We're lucky here in Omaha to be in the middle, of a larger city, that we have a lot of access to medical care. Some people aren't really that lucky to have a oncology or hematology center that close to them. So I just want to talk to you and see what obstacles you experienced. Was it distance from the treatment center, or did you have issues with, caregivers, or how did it impact your life? You were in school. How did it impact your studies and your job and everything else? So did one of you want to start?
I think the impact was mostly, well, there's impact of physical, whereas I used to be able to do all kinds of physical things very easily, boom, boom, and now I couldn't because I didn't have enough oxygen, or I was afraid I would bruise myself. So, having contact, playing flag football, any of that kind of stuff I still did it, but I was very careful, because when you get a massive bleed, which I had a number of times, it's not fun. How did it affect? Again, when you're young, when you're 22 and you don't see and the horizon is given you for here, it's a very mental game to turn that horizon into a long time horizon. Fortunately, I was at school at Minnesota, and Minnesota was a very strong hematology place, so I could get clinics and weekly clinics and every 6-week transfusions very easily. And then when I started my business in 1975, and I was working 70, 80 hours a week with low blood, I think that I was still in the Twin Cities, so it was easy for me to get there. I was not married. I had no kids, obviously. My parents were still alive. My brothers were very active and very, and a large family of cousins. So we had a tremendous prayer thing going, and I think that helped a lot. But I mentioned this earlier talking to these ladies, that when I started the business, it was a restaurant business, 70, 80 hours a week. It would be difficult for anybody with normal blood. It was a push. But because it was my own business, I was happy. We were struggling, but we were making money, and I had a lot of great kids working for me, and we had a wonderful product and all kinds of positive things going on. And I would go home from work after 11 or 12-hour day and take a shower and pretty much pass out and sleep till the next day I went into work. But I think being forced to work hard physically, which the restaurant business is, and to have the attitude of, I'm happy here. I'm not morose. I'm not down. I don't hate my job. I'm, that kind of thing. again, like I said last time, I think attitude was a lot. Now, some difficulties. I know I was driving on the freeways around the Twin Cities one day, and all of a sudden I had blur stuff in my eyes, and I thought, what the hell? Sorry. And I called my doctor, and he said, what's a macular hemorrhage? And I go, oh, well, that's cool. And that's, you know, you have blood vessels that because of low platelets, they break. And I said, well, will this go away? He said they should. I said, well, I get more of them? Probably. So, you know, that's one thing. I had to have some wisdom teeth taken out. Most people go in the dentist, they have the wisdom teeth pulled, right? I had to go in, and they did it in surgery. They put me out, I was in surgery. They took out 3 wisdom teeth, my jaw got infected. I looked like a squirrel with a mouthful of acorns. And I was on heavy antibiotic drip for several days and bleed. You know, that's the only time I had platelet transfusions because it wouldn't stop bleeding even with cauterization. So you just run into all kinds of stuff. You know, today I've got shins that have dark things that look like permanent bruises from iron overload, and it was stored down in my shins. So it doesn't matter because I don't really care. I mean, it doesn't look the greatest, but you know, it really, all the stuff that you kind of worry about and think about when you're a kid or when you're young, or whatever, a lot of that stuff is like, this is not important. Living every day and knowing that you're alive and knowing that there's hope and that the treatment can work and whatever, you know. My bone marrow aspirations, my bones are very hard. I played a lot of sports and never broke a bone, basically other than fingers and noses from basketball. But literally when they did the bone marrow aspirations, the doctor had to get up on the table and put all his weight to get through my butt bone, or what do you want to call it, in the back there. And so, and I just remember it wasn't terribly painful, but it was one of those things where it was, you know, and he kind of laughed and stuff and said, I've never run into a bone this thick. So these are just kind of things that you go, you know, this is what you got. You got what you got. You're born this way. You acquire a disease through hook or crook. Mine was from spraying yards with xylene and DDT, calthane, malathion, Saigon, et cetera, in the 60s. And so my aplastic came from chemical exposure for the most part, as much as we know. Sorry, kind of long.
Let's see how it maybe affected me. When I went in for my follow-up to find out, you know, what he found, I was by myself, and I mean, I didn't think about taking anybody with me, so, and this is what I think he said. He said, honey, I hate to tell you this. And usually when people preface it like that, you know that it's not going to be something like fun times. He told me that it was myelodysplastic syndromes. It's considered a blood cancer. And of course, like I mentioned earlier, the blood cancer I was familiar with was what my mom had had. And I was like, okay, is this hereditary? Is this a genetic thing? Is this, how did I get this? This and that and the other. And with MDS, most of the time they really don't know. They don't know what it's caused. They know benzene is a big chemical that I just think is one of the drivers for it. I grew up in a rural town, small town in Nebraska. We worked out in the fields. For those of you that don't know what detasseling or roguing is, feel free to look that up. But we were in fields that had been sprayed with who knows what kind of chemicals. I was also a lifeguard, so we had chemicals in the pool. My dad owned a gas station, so I was always down there working around, pumping gas, working with him. So who knows what that exposure was.
But you had a lot of it. A lot of exposure, yeah.
And my parents both smoked. So, you know, we know benzene is in cigarette smoke. There is no blame here. When you just try to think, how do we put this all together, like Kim had asked us, I remember walking to my car and thinking, I'm sitting in the parking lot of a cancer center. And it just seemed like it took a little bit to think, okay, I don't know what this is, but I'm going to do my research. So I found as much research as I possibly could. I asked for the right sites to go to because Dr. Google can scare the daylights out of anybody if you let him or her. So I went home and I texted both of my sisters and I said, I need to get on a joint call. I want to share what I've just learned. And they, they were quiet for a little bit, and one of my sisters is a nurse, and she just said, well, is this related to what Mom had? And I said, no, it's different. And I said, don't worry, I'm going to do as much research as I can. So to me, even though I was working full-time at the time, I didn't really have any side effects. I mean, I didn't even know. I just fainted in my apartment that night, so I thought, okay, maybe I just stood up too fast. So I continued to do as much research as I possibly could. I was referred by that hematologist to Nebraska Medicine. And when I think about, I had lived in Kansas City for 27 years, and I just relocated to Omaha 4 months prior to my diagnosis. And I thought, I'm 15 minutes down the street from a world-class cancer center. This cannot be a coincidence. So when we talk about faith, I believe in God, and I believe He has a plan for us. We don't know what that plan is. And when people tell you, try to live every day as the best you can, that has really sunk in, because as Kim said earlier, when you receive a diagnosis like this, it's life-altering. Nothing seems the same. I had this sense of urgency, and I thought, oh my gosh, I want to do so many things. I want to get all this stuff done. And I didn't even have really like a prognosis. It was only based on this scoring system, which they've just changed as of last year to make it even more comprehensive, to give the physicians more information and what's the best way to treat this patient. And within MDS, there are numerous subtypes. So it's not that one-size-fits-all approach. I live here in Omaha. I also am in support groups that are on the national level, and a lot of people live in a rural community. They might not have easy access to a center of excellence like I have here. So I know there's that. People struggle with, how do we get there? Average age of diagnosis for MDS is 71 to 76. I think that's what I heard this morning. I was 54. So if you think of folks in their 71 to 76, they may be retired. They may be in a different pace of their life right now. So it's different in that regard for them. I just feel really fortunate to be able to be here. I have insurance, so that helps tremendously with the costs. My oncologist knows that if he wants to try something or share something, he knows that I'm going to need a little bit of time to do my own research on it. And then I'll come back to him with an answer. That just works for me. Can't remember what else you asked him as far as any sort of...
Just talking about, any obstacles as far as like distance, frequency of visits, how you fit work into that,
As I said earlier, mine was, okay, we're just going to do labs I think it was every 3 or 4 months. So that's an easy trip down here. It was 15 minutes in the car. I worked in a small office at the time. I could just come and go as I please. I'm self-employed, so that helps too. I knew how to get here. It's easy. Parking is easy. And that's what it's been in this watch and wait. Only when they schedule a biopsy, then you know what? That's going to take a little bit more time than your regular labs, so that it's like a doctor appointment. But as Roger said, with these low blood counts, they look at other things as well. So I did a clinical trial way back in the early part. They wanted to see how MDS affected the brain. And because I was on no medications and hadn't had any treatment, they were thrilled to have me in that group, because they're like, okay, this lady's clean right now. Let's use her information. But during that clinical trial, they did something with eyes, and they noticed something in my retina. So they wanted to make sure they keep track of that, because I wouldn't know if it was bleeding behind my eye. So I've got a really good eye doctor. So he keeps track of that. Yes, I've had dental work, and we had a lot of bruising because of that the first time. The second time I had dental work, we went ahead and I had a platelet transfusion first, just to try to avoid any sort of massive bleeding or major bleeding. It does affect everything. You have your typical symptoms, maybe shortness of breath. I bruise very easily. Fatigue, not only physical fatigue, but mental, and it's different than what you just think of, oh, I'm tired, I'm going to just take a nap. Well, most of the time that usually doesn't really help, but you just get used to it. You change your schedule. You do things a little bit differently. And again, like Roger said, attitude, attitude, attitude. If you can keep it positive. I also do meditation, mindfulness, acupuncture. And yes, I talked to my doctor about all of this. He said some of these treatments have been around for thousands of years, and if you want to do that, please feel free. The only thing he asked me was, if you want to start taking supplements, would you please talk to me first? Because he would like to have my blood as clean as possible. So, I mean, he knows what's in there. So then he said, I know better what I'm working with. So.
And I think we have a question from the online audience.
We do. Yep, we do. Thanks so much, Kim. Our question is, and this would go to both Roger and Barbara, how do you get your doctor, or how did you get your doctor, or do you get your doctors to look beyond your test numbers and look at the impact that your disease is having on your life?
That's an excellent question.
That is an excellent question, and I just had this recently. There is the cancer survivorship program at Nebraska Medicine that I just found out about a couple of months ago, and I met with one of the gals that works in that group, I think 2 weeks ago. And what she looked at, I mean, she took all of the information from my doctors and sort of put it together in a plan, or almost like a map that says, here's what's happened, here's what you have done, and here's what we can think about going down the road. She checked everything else but my diagnosis, but my disease, meaning thyroid, bone density, cholesterol. It's not that these things aren't important, but that's not, to me, in my opinion, that's not my oncologist's field. He's focused on what I think should, and I don't like that word, but on what he is supposed to be focusing on. Just from having met with her, and yes, she asked about mental health as well, because we think about depression and how things have changed in our lives. She may talk about hormonal health, just your overall. And I just felt so acknowledged, because all of that is important too. So I have that in place. So hopefully that helps answer at least my portion of it.
Hit me with the question one more time, because I've got so many things
Sure.
rolling in my head
Yep.
that I want to.
So the question was, how did you get your doctor to look beyond your test numbers and look at the impact that the disease was having on your life?
I don't know that I had to do anything. I mean, he could see, you're 20-some years old, and there's no real cure, and you're kind of an overall test case of anything and everything. And I mean, I took vitamins and juice fasting and all kinds of stuff, and I basically, he said it can hurt you. Go ahead and try it. I would try anything. I want to say something about impact on life, and then I want to touch on PNH very briefly, because this is the early stages of my recovery from aplastic anemia when I was 34 years old. and that was a spontaneous remission. I mean, it basically, one day after 11 years of transfusion, my marrow kicked in and I started making blood again. Through the years, because I felt blessed and I felt that God saved my life, I coached kids. I did public speaking on entrepreneurship and all kinds of other things. And I have, 5 foster kids that I help raise because I figured God gave me a gift, in addition to sports and business and that. But the main gift he gave me was to be a good dad. I was a good dad. And there are so many kids out there that didn't have it. So doing things that are a reward for others because you've been blessed is really, in my life, been very strong. PNH I had from age 44 to 52. And again, that was one of those things where they said, well, you're going to be on Danacrine and prednisone your whole life. Well, I was already kind of an ADA, not ADA, ADHD or whatever, kind of a person. I was, I'm always on the go. And so these steroids kind of jacked me up and ended up having a deleterious effect on the marriage of my wife, of my children. They were older, so it was not as critical as it is, but we got divorced, and we're still good friends. And she stuck by me this whole time when I had it, and she's remarried and I've remarried. But I think that's another thing. Go through life. Do not hold grudges against anything. The more grudges and things that you hold, the more it drags you down, and you need every bit of positive to get through what you've got. Again, right now I'm healthy except for COPD, which happens when you get old anyway. But for Barb and many people that are still in the throes of this thing, you're pissed off at somebody. Don't let it get you down. You're angry at somebody. Somebody honks the horn behind you. The natural thing is, but don't let it get you. Let you be the winner of your daily battle every day. Sure.
I want to say one more thing to the person that asked the question. You oftentimes hear somebody to say, just be your own best patient advocate. I strongly agree with that. Oftentimes you think, well, I don't even know what to ask. Tell your doctor, I don't know what to ask, but these are some of the symptoms that I'm feeling that I'm not sure if they're associated with my diagnosis or not. I want to know as much as I can about what I can, so I'm always asking, looking, checking. I've put my own healthcare team together to support myself through this because I said I'm not doing this by myself. And when you have expectations on people, it's really challenging. So I take those off, and I know what my oncologist is there to support me in. I know what my primary care physician is there to support me in. I know what my gastroenterologist, all of those folks, I see them as my team in a big circle around me, and they're here to support me with their skill set. And even as Kim, she's case manager, in charge of case managers with a tremendous group of individuals that are one of the biggest supports I could have that work with my oncologist. So be your own best patient advocate.
And one thing that Barb said earlier when she got it, and the same thing happened to me, I looked into toxicology and what does xylene related to benzene, who are the people that were getting it, farmers, painters, et cetera, that were sprayers of toxic stuff. And so do your research, whether it's health research, vitamins, exercise research, yoga research, and medical research and toxicology, any kind of a thing that you think might have a relationship, do your research and know. And come to places like this or beyond videotape or whatever that's going on here. Do it. And I'm here to find out. Basically, the last time I was at one of these conferences was in Minneapolis 15, 16 years ago. And I got the thing, and all of a sudden it struck me that maybe I should go find out what the latest and the greatest is happening with these diseases. And also to be here to, if necessary, give hope to people that you can be diagnosed at 22 and still be alive at 75. That there's hope, and you're not looking at a dark picture. Don't see the dark picture.
Those were excellent points. Something that I picked up on, Barb, when you were talking about kind of assembling your healthcare team. I think one thing, and just being a member of a healthcare team, to advise the person who asked the question, is that you do have a team of individuals that are here to help you, and a lot of times people in the team have their own expertise. So I think it would be important to utilize your team and talk with them about how you're feeling as a patient beyond your diagnosis. And there's social workers, nurses, doctors, and they all work together to kind of help that whole patient. I think we have one more question.
Yes, we have one more question. And Roger, this is for you. It says, I'm just wondering if Roger is currently taking any medication. And it says, it's amazing that you have survived from such a young age. God bless.
I'm on medications that are not related to blood, but not very many. I mean, I've got very healthy cholesterol and heart and all that sort of thing. I do take tamsulosin, which is for urinary frequency, with minor stuff like that, but that happens with most people my age anyway. I still take lots of vitamins, and I'm very lucky to be lucky and blessed to be here, and I think God had a role for me. And so, but right now I'm not on anything that has anything to do with the blood disease. Again, the PNH, I had a remission of the aplastic in 82, and I had a remission of the PNH in 2000. So I'm almost 23 years clean of the blood diseases. That's not to say it can't come back. I don't know. Who knows? I thought I was out of the woods when aplastic went away, and then 8 years later, PNH showed up. So I'm hoping I don't want to get what you've got, or anybody else for that matter. I've battled that, and I think I'll stick with the COPD right now. Deal with that.
You have quite a remarkable story.
Yeah.
Quite a remarkable story, definitely. Do
We have another
question?
question. This one's for Barb. Barb, you've been diagnosed with MDS at a young age. Has transplant ever been discussed with you?
That's a great question. Yes, it has. Over this 6 years, like I said, we are continuing to monitor my blood in addition to the biopsies. I met with him just this week, and we like to, it's almost like we're standing on a line and we can see transplant in the future. I believe I will qualify for that when and if the time comes. But yes, we've talked about it. And I was telling Kim, it's easy to try to think ahead and say, oh my gosh, what am I going to do? I need to get a caregiver, blah, 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 blah. I really try to stay in today, because really this is, as far as we know, this is all we have. So, but it hasn't, yes, we've talked about it. To me, it's almost like we can see the start line, but it's still down, it still seems far away. But we also know with this diagnosis, it could change tomorrow, and we may be looking at something different, or that line may be getting closer.
And this question is for Roger. Roger, what do you put your spontaneous remission down to? Do you think supplements played a role in your recovery?
Yes, I do, but like I said, I threw everything, they talk about, well, let's throw it against the wall, see what sticks. Well, I threw virtually everything you could think of against the wall. So I think supplements were a part of the overall package that I was dealing with. I think just keeping alive with the transfusions helped, because every 6 weeks I'm still here. That's good. I'm improving somehow, some way. I have to say that I'm a very firm believer in miracles, and I believe that God had a path for me that was that he wasn't ready to drop it. I wasn't ready to be taken out of the picture at age 22 or age 42 or whatever. I think the most important thing was faith, belief in miracles, a strong support group, family and friends, etc. Those things are so important. There's so much power in the universe and so much healing power that's floating around out there, and it has to be focused into you. That is probably more so than just supplements or yoga or all the other things that you try. Is believe in God, and all good things can happen.
We have another online question. The question is, have either of you found support groups helpful, and are you part of any Facebook support groups? Facebook support groups, social media groups.
I'm going to give this one to Barb first because I know that she has a lot of involvement with support groups.
Yes, I find the support groups extremely helpful. We had one here at Nebraska Medicine just for blood cancer patients prior to the pandemic. Since the pandemic, they have gone online, and they're in the process of sort of changing that around. We may be going actually back to in-person. They're talking about it, so that would be great. I'm involved with 2 different support groups, one through the AAMDS International Foundation. The other one I follow is the MDS Foundation. I'm actually in the process, the last couple of months, I've facilitated a national group for MDS Foundation because our regular facilitator received his transplant, and I think he's on day 44, and he's on the East Coast, and he is home, and he's doing very, very well. So I'm so happy for him, and I was happy to be able to facilitate the group. How the group supports me is what I call my Get It group. So oftentimes we just want our friends or our family to understand and get it. And I'm really not sure that's possible unless you're diagnosed with it. I know that when I get on that call, everybody on that call knows. They know exactly what I'm talking about, whether it's fatigue, being anxious about results, biopsies, painful, not painful, whatever it may be. And I'm also it's a low-risk MDS group on Facebook. I sometimes find that to be helpful, but like we mentioned earlier, I really try to focus on the positive. I am a realist. I understand what I have, but it's really easy to be pulled over to that, what I call the other side, and start to feel discouraged or sad. And I know what it feels like, and it doesn't feel good. So I would rather be over on the other side. But we have to be on both sides to recognize what can we do to move it forward.
Formal support groups at that time, no. But what happened was people who had a bad cancer diagnosis or another blood disease diagnosis, people knew that I was a survivor, and they would call me and say, would you please talk to my sister? She's flying in from Baltimore, wherever. Or, my best friend's got prostate cancer, da-da-da-da-da. And that became my support group, is me supporting them and them supporting me. But it wasn't anything formal, like a Facebook deal. Well, of course, they didn't have Facebook back then. Yeah, informally, yes, that was my support group. And the other thing, too, is I have a very strong, big family and a lot of friends and a lot of athletes that I played sports with, that came to my, I don't want to say rescue, but came to my support, not on a like, let's meet every week at Perkins or something like that. It was just, they would ask, how are things going? And we're thinking about you, we're praying for you, and blah, 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 blah. And so happy to see you. Man, you look good. I mean, just all that kind of positive stuff that you get when you see people and they go, well, you don't look so bad. Are you really even sick? That's kind of a thing that makes you feel like, I'm doing okay. So yeah, I think if the worst thing you can do is hole up and be a squirrel and live in a hole in the ground or something like that. Get out there and be active in life. And whether they have MDS or aplastic or PNH or something, Max nix, as they say in Germany. Take a cancer patient or I've got a very good friend who's got Parkinson's disease and he's been struggling for 12 years. I make a point to get out to Denver and visit him twice a year because it gives him joy and hope. And so I can be part of that support group.
Yes.
This question is to you, Barb. You mentioned when your doctor suggests a new therapy or something, you go back and do your research and then come back and say a yes or a no. Can you walk us through your research process? Where do you go find information? How do you process it?
That's a good question. This anti-thymocyte globulin treatment that I did last year, I was really clear and to make sure that it was not, I was like, okay, this is not chemotherapy, right? Because that word, you just go, okay, wait, that's really serious. Even though what I have is not a walk in the park. But he had mentioned it. And I keep notes. Every appointment with him, I have my same little journal that I write in. And I looked back, and he had actually mentioned that treatment 2 years prior. He said, this is something that we may consider down the road. And I thought, So when that down the road came to that point, he had already mentioned it. So I just kind of did my research again, just for a little refresh and think, okay. But one of the things that system is made up with is serum from a horse or a rabbit. And I thought, okay, that's weird. So then my questions were, okay, where are these horses? What are they fed? Where do they live? And he was like, I had a feeling you'd be asking me those questions. Not that it mattered, but I really do. I think, gosh, are these horses treated specifically for stuff like this? I never did get an answer, but by that time it had already been 2 years. So anyway, I just did some more research. He always gives me the right websites to go to. And I just thought, you know what? Why not try it? Had the list of side effects. I just said, I'm not going to do those. I'm not going to have those. Out of how many that were on there, I only had 2 when I was in the hospital, and the nurses were treated it like it wasn't even 2 minutes. Just put something in my IV and it was gone. So, yeah.
It's interesting that you brought the horse ATG. Just so you know, they were talking about that when I had aplastic anemia 45, 50, long time ago. So that isn't a new treatment. They've been around for a while. I have no idea the pedigree of the horses either, but that's not a brand new thing. It's been around for a while.
So if somebody were looking for support, you talked about some different support groups that you were part of. Where would they go to find online support groups besides Facebook?
Well, obviously, I started right here with my healthcare team. I asked, is there a group available for folks that have what I have? And they said yes. Then I did research on the MDS Foundation, information on the AAMDS International Foundation. Both of those websites are filled with information on excellent definitions, support groups that are available, upcoming webinars that you can sign up for. I do watch a lot of webinars because it's just additional information if it relates to me. I think on Facebook I just put in something like MDS group and it brought up a bunch of groups. I also have my own support group, what I call my group of family and friends, and they provide support to me in a way that's different than what these groups are, which is typical or expected, because I know what my friends can do for me. And all of that is so very important. They could be listening. They don't have to understand exactly what I'm going through, but they're really good listeners, and they can support me in all kinds of different ways. I've also done research with the Leukemia and Lymphoma Society. It doesn't necessarily always say MDS on that site, but they have support groups available that anything dealing with blood, they're gonna know, they're gonna be able to direct you, and they understand. They're that get it group. So out of those are three of the big ones that I follow. Some of the folks in the Facebook group are actually from Europe, so they may have their own websites and things available over there. I know Dr. Gundabaloo talked a little bit about differences in treatment maybe in Europe than here in the United States, but to me it doesn't help. It doesn't hurt, doesn't help, whatever. If it's more information for me, I'll get it.
I have one support story, and it has nothing to do with a group. But seeking out somebody that you know has your issue, if you're recently diagnosed or whatever, is important. Last Christmas, I get a card from Sacramento, California. The name on the return address, I have no idea who this is. I open it up, and it said, Roger, it's been 25 years since my bone marrow transplant, and I want you to know that I'm healthy, living with my husband in Sacramento, and your counseling and support when I was going through the bone marrow transplant at the U of M hospital meant the world to me, and I realized I'd never gotten back to you. So the rewards are everywhere if you reach out. Somebody told her to see this guy who's still alive, blah, blah, blah. And so I was able to be her support group, one person, and kind of help shepherd her through the whole painful process of, graft versus host and all the other things that happen with transplants. But at any rate, so I wrote her a Christmas card this year, and I said, you can't imagine how your card lifted me up. And so if you've got a compliment or an expression of thanks or gratitude, do not keep it to yourself. Get it out there.
That is excellent advice. So we have about 8 minutes or so, I think, before we wrap up. So I just wanted to kind of, Roger and Barb, you both talked about a lot of tools that you guys pulled into your toolbox to kind of help you get to where you are today, to get through some pretty tough times. You talked about a lot of tenacity and kind of just throwing everything at the wall and see what sticks, a lot of different things. And you've talked a lot about research and advocacy and kind of finding the tools that you need to kind of help you get through. So I just wanted to kind of find out, do you have a most important tool that you have to get you through this? And what was that most important tool that you have?
I would say my faith. I remember when I got home after receiving my diagnosis, I sat in my chair and I just said, okay, God, here we go. Our relationship is going to look different to me. I know that. Roger said something earlier about energy. We all have energy. Things give off energy. And if you're paying attention and aware of where that's coming from, and if it feels right or if it feels wrong, pay attention to that. It's not going to waver. And even if it does waver, that faith, I can still go back to what I call just those grounding principles when you're just really sure. And yes, it's easy you can feel afraid. I'm not saying that I'm just going through life and everything's super. But I think let's redirect that thinking, and how can it make me feel different or better? And then I just opened my toolbox and go for all those other things I mentioned earlier.
I would have to ditto Barb on that. Faith, belief in God, belief in yourself, tenacity. I don't care what you're doing, whether it's dealing with a blood disease or getting a new job or working out every day and having the chutzpah to get up at 7 in the morning and do your workout when you really want to stay in bed and sleep. So stick to it, tenacity, but I think faith in God was the number one tool in my box and is still today for not only blood diseases and raising children and dealing with grandkids, etc. It is the most important tool you can have. So as I said in the speech in Minneapolis years ago, and my daughter was there, I said, if you don't have a relationship with God, I suggest you get one.
One more thing, I like to read, and I like to read stories of other people that may have a similar, like MDS diagnosis. So when I hear other people's stories and what helped them, I think, wow, can I use that? Is that something that could be helpful to me going forward? And there are a couple of books that I just have them to where I can see them every day and think, that young girl did it. I am too.
One question. Okay, I'm good, thank you. For somebody who is newly diagnosed that is struggling, what is your best advice to a newly diagnosed patient who may be experiencing challenges and barriers?
First off, take a couple deep breaths. Take in that information. Again, if you can advocate for yourself, even if you don't even know what to ask your doctor. Just say, I don't know what to ask. What can I expect? Most of the time, my experience has been they can kind of lay that out for you. It's almost like a little plan. Here are the next steps. So oftentimes I think we're set up to, what's the next step? What can I be doing? What can I be thinking about? That's how he laid it out for me. And then I tried to stay calm, because nobody likes to hear the word cancer, at least not that I'm aware of. But I think it's very different today. There's been so much progress, even in the 6 years since my diagnosis, so I feel very fortunate. But again, I said, I take a deep breath, and I found out what I needed to at that time for me to move forward.
Barb brought up, people hear cancer and automatic fear. I'm going to die, I'm going to die. First of all, eradicate fear from your life in everything, especially cancer, health, whatever. I mean, yes, of course, the natural thing is to be a little bit of afraid, but get through that and deal with that point blank. The other thing that you said, opinion. Should I re-diagnose? That's the question, right? Well, they always say, you got some bad news, get a second opinion. What's wrong with the third or fourth opinion? Get as many opinions as you need to make you feel comfortable. If one you're not happy with and two you're not happy with, get a third, get a fourth. Don't stop.
Very good advice.
Sometimes when you're older, you have the thought and you have to kind of wait till the Rolodex opens again.
I think I do want to add to that, because in my experience, some patients have felt like if they get a second opinion, it's going to be offensive to their healthcare team, but it's not. Their healthcare team is very willing. No matter what decision you make, we want you to be very comfortable in the decision of your plan. And if it's, the opinion at one center versus another, it doesn't, you are the most important part of that treatment plan, and you have to be very comfortable. So don't feel like your team is going to be offended if you are seeking a second or third or fourth opinion.
And if it offends your first team, get another team.
Well, thank you so much, Kim, for facilitating the panel today. And thank you to Roger and Barbara for sharing your personal stories and your journey and your helpful tips. It means a lot to the patients, and it means a lot to the foundation, your willingness to share about yourself to be able to help other people. So thank you from the bottom of our hearts for today. If you'd like to watch the session again at a later time, it will be available on the conference platform in the next hour by accessing the session, clicking on replay, or by navigating the on-demand tab in the platform hub. If you happen to have any additional questions, we'd be happy to help them get answered for you. So you can send us your questions in 3 ways. Send an email to help@aamds.org. Give us a call at 800-747-2820, or you can submit your question to our Facebook page. If you're online, please take a few minutes to complete the session survey. It's important to us that we get your thoughts, and it helps us for future educational programming. This concludes the educational part of our conference. If you're watching online and you'd like to join the online support group, please just use the Zoom link that is provided. On behalf of the Aplastic Anemia and MDS International Foundation, thank you for joining us and making us your resource of choice for information on bone marrow failure diseases. Our medical advisory board and team are always here to support you and your family, as we've done for the past 40 years. Thank you for spending your day with us. Take care.